Hey guys, reflection in physiotherapy is an amazing tool for your learning, especially as you're developing as a new grad. So today I'm going to talk you through a reflection on one of my patients that I've had this last couple of weeks. And we'll go through a little bit of the decision making around this patient and the different treatment options and talk you through the outcome that they had. Hey, I'm Leon the Physio, welcome back to a new one. So this patient of mine that came through, he was a 50-something-year-old male with lateral thigh pain and back pain when he walked. He'd had this pain for many years, experienced it mostly when he was sitting in the car. This is the lateral thigh pain, but then would also get the back pain when he walked longer than 15 minutes. Lateral thigh pain was described as an ache down the leg, sort of between the hip and the knee. Nothing in the knee itself and nothing in the hip itself. And the back pain was a central back pain with no neurological signs. Now this patient didn't have a history of trauma. This is just something that had been building up and had been getting worse over the last 10 years. So with this patient, the first steps for me with my decision making was the diagnostics element. What path was I going to go down to determine their diagnostics? Now this fellow was quite unhealthy. He was really overweight, did no exercise, had a BMI of about 50. And so assessing was a little bit of a challenge because of that. But on his examination, I was able to reproduce some of the thigh pain with some hip tests, so your Theta and your Faber, but I wasn't able to reproduce it on anything functional. With his back pain, general range of motion tests didn't bring anything up, and he was a little bit tender on palpation through his spine. So the decision at this point was, what do I do to narrow down my diagnostics, especially that lateral thigh pain? So we could reproduce it a little bit on his hip tests. We couldn't reproduce it with any sort of neurological testing. So at this point, I'm thinking that it's likely to be driven by his hip joint. So what should I do to narrow down my diagnostics? Now with this patient, he was really overweight, he was really unfit, and the pain that he was experiencing was about a 5 out of 10. Now, for my diagnostics, I could have gone down the path of imaging and gotten just a plain x-ray just to evaluate how the joint was going. But my feeling with this patient was that if he just enacted a few general health principles, we could have avoided that and still had a good outcome. So my decision diagnostically then was we weren't going to rush into any sort of imaging. We were going to enact some basic physio principles and see if we could yield an outcome that way. So the patient also told me that in his hometown, he would get some soft tissue massage, and that was something that he'd found useful in the past. And so part of my decision making to get this patient on side early was that we would do something like that had helped him in the past. So straight away, our treatment was just some good old fashioned soft tissue work up through his lateral thigh, into his hip, and then into his back, just to give him some sort of short-term relief with his problem. But we then had quite a robust discussion about the role of exercise with treating this sort of problem. And so from that, we came up with a really basic set of range of motion stretches. So just some glute stretches, some quad stretches, and some hamstring stretches. And then a really simple walking program that started with 2 sets of 10-minute walks with a 5-minute break in between. Now, I came up with these 2 sets of 10 minutes because he told me that he would get a sore back after about 15 minutes. Then he'd have to sit and rest for it to get better. So the 10 minutes was just a nice way for him to get 10 minutes of walking that was pain-free, have a rest, and then get up and do another 10 minutes that was pain-free. So my idea there was that if he could do the 10 minutes and it didn't hurt, then he was more likely to follow this 10-minute program more consistently. So the stretches, I know they're not going to fix his problem, and that we know with these sorts of hip conditions that strengthening is really what you're after. This was more of a longer term play to get the patient on site and just to get used to the routine of doing something every day that was proactive for his health. Now from there, when he came back the next week, he'd had some mild improvement, maybe about 10%, which I wasn't surprised by. I think that was fine. But the really good news is he'd been really consistent with his walking and he'd been really consistent with his stretches. So I felt as if I'd had him on side to then progress into something a little bit stronger with his exercise. So from there, we then treated him again with the soft tissue work because he said that he found that quite useful. So again, we know long term it's not going to help, but again, keeping the patient on side was really important here. So we gave him just a good strip through, up through his lateral quad, into his glutes and into his back. And then we went out into the gym and worked through some simple lower limb exercises to help build some robustness in that sore side. So he got given some squats, some calf raises, and some gentle hip abductions in standing. I told him with the stretches that he should continue to do those, maybe as a first thing in the morning, just to get him going, and then do his strengthening exercises a little bit later in the day. With his walking program, we kept that the same because he was still getting a little bit of back pain after the 2 sets of 20, but he found the 10-minute bouts were manageable for him. And then over the next couple of weeks, we sort of followed that similar sort of path. We would catch up, debrief on how we went with his exercises that week, what his pain levels were doing. We'd give him just a good strip through his quads, his hip and his back to keep things nice and calm. And then we would steadily progress his exercises and his walking program. In the end, he was discharged with doing a 30-minute walking program every day. His exercises had progressed to weighted squats, some lunges, and then some hip abductions with a resistance band. He was getting no pain when he was sitting, and he was thinking about joining a gym when the lockdown had finished. So where we left it was he was going to come back and catch me in about 6 weeks' time, when we would add another set of progressions to his exercises again. Then we would look at progressing his walking program and see how he'd gone with joining into a gym. Now, this patient was a really nice one to reflect on because it could have gone 2 ways. We could have gone down an imaging pathway to have a look at his hip joint, but my feeling was with this patient, he wouldn't have done well with the incidental findings that we were likely to find on an x-ray. You know, some form of mild arthritis. That I knew that would be used as an excuse as to not do the exercises, or as a reason for his pain getting worse, or as a reason for why he shouldn't engage in, walking and things like that. And so my feeling with this patient was it would start a cascade of more negative health decline. The other thing that I think is worth reflecting on as well is the engaging in therapy that we knew long-term wouldn't provide any value, but would keep the patient on side. And that was, for me, the most important thing with this patient. Like, we had to start slow and start small and start with things that sort of felt good, but we knew long-term weren't going to do anything, like the soft tissue massage and some simple stretches. But what that would allow us is to build more of a therapeutic relationship, to then have the permission to add harder things like strengthening exercises and progressing his walking, and really telling him off if he didn't do his exercises. Because it could have gone the other way. I could have gone down the imaging pathway, which could have shown some arthritis. I said, okay, well, arthritis, we know that this stuff responds well with strength-based exercises, and we know that soft tissue massage doesn't work. Now, in the long term, that might have shot back at me. That might have been, he might have gone, well, the massage makes me feel good, and I've got my bones are, they're eroding away in my hips, so why would I do strengthening exercises? And so my feeling was it wasn't worth going down that pathway and sticking with simple physio principles that we knew would work, but really working hard to get that patient on side with the things that I knew wouldn't work long term, like the soft tissue massage and the stretches. So there you have it, just a really simple reflection on a pretty basic patient, but a few of the key messages that I think are good to learn from this one. The first one is you probably don't always need to rush into imaging, so a watch and wait approach is fine, especially with something that can afford to wait. Something like a mild arthritic condition, we don't need to dive into imaging straight away. We can just apply basic physio principles and see what result that yields. And then you've always got imaging as a backup should things not improve as quickly as you would hope. The other one is engaging in therapies that we know long-term aren't going to do anything. So, stretches and soft tissue massage. Now that was, I think, crucial for this patient because it got him on side with me, and we were able to engage in a long-term therapeutic relationship that ended up with him doing the things that we know work, like the strength work and a walking program, and a progressive walking program. Had I not done that and just gone straight into, all right, you need to do these exercises and soft tissue massage isn't going to work, we might have lost him, and then we wouldn't have had the chance to build in this stuff that we know long term is going to have an impact because he would have not found the therapy useful. And then the last one that I think, now that I'm thinking about it now, is progressing slowly. You know, in physio land, we're really keen on lots of progress quickly. And every time we catch up with a patient, we should be trying to progress something and push it harder. You know, we really need to think about physiologically, it takes a long time for our body to get strong. So we're looking at a minimum of 6 weeks, and that's if you're doing an optimal dosage to get stronger. So with this patient, we had moments where we'd catch up and things would stay the same. We'd just catch up, talk through it, bit of soft tissue work, have a chat about it, and then decide, you know what, the level that you're at now is fine for the next little bit. When we catch up next, we'll hope to progress it then. Or it was, okay, you've been pretty slack with your exercises this week. You need to jump back on the exercise bandwagon. Here's maybe a little change to make it a little bit more interesting. We'll catch up again soon, and then we'll aim for progressions there if you've been consistent with your program. And then lastly, it was really focusing on the simple fundamentals that worked. You know, we didn't engage in complicated core strengthening exercises for his back. We really just got him doing some squats and a bit of walking and getting his body stronger and a little bit more resilient to the things that were giving him grief. Now, you might be thinking, oh, but you might have missed something because you didn't do an x-ray. And you're right, if after a couple of weeks we weren't seeing the results that I would have hoped, then absolutely we would have gone down the x-ray path. But because his pain started to drop quite quickly, I was happy to continue with that watch and wait approach, focus on the physio fundamentals, focus on getting him strong and improving his fitness and losing a bit of weight. And that for us yielded a really good physio result for him. And he was able to go back to the things in life that gave him a bit more meaning. So being able to, you know, walk around with his kids and it also sort of jump-started a bit of a health kick for him. So he went and saw his doctor, got a set of bloods done, and is now on a really good exercise program, and long-term should have a really good result. Anyway, that's just a quick reflection. I hope you found this one useful. I'm Leon the Physio. I'll see you later.